Someday, baby, we'll be old. So baby, we'll be old and think of all the stories that we could have told.
I'm Anne, this is Jack, and this is Cleo, and today we've decided to focus on lifting and moving heavy kegs.
We chose this topic because kegs they're big, they're awkward, they're heavy, and just personally I've seen a lot of incorrect lifting techniques that could possibly cause an injury.
Lots of casuals, they aren't trained in correct lifting techniques, so they're more likely to get injuries, and if these injuries do occur, they very often will not get workers' compensation for it because they're casuals. There you go. Em, can you please put that keg in the fridge? Oh.
Emily, what are you doing?
I'm trying to take the keg to the fridge.
You don't carry kegs like that ever on your shoulder, okay? It's putting too much pressure on these lateral flexors of the trunk, and it's putting an asymmetrical load through your whole spine, okay? You're next to the side. Next time, use two hands and keep it close to your body, okay?
I'm Dr. Dragan, and I'm going to talk about Emily's terrible lifting techniques. This is a normal human stance. This is how Emily was standing with the keg on her shoulder. She was standing this way because she was laterally flexing to compensate for the extra weight of the keg. This was working overtime on her quadratus lumborum and her internal and external obliques. This lateral flexion caused pressure in her vertebrae of her spine and also made her centre of gravity move slightly into this direction. Her compensating movements caused her centre of gravity to be over her base of support.
Whoa, Emily, that's not what I told you, okay? Just then, what you were doing, you're putting too much pressure on your rectus spinae group here, alright? They're not used to that much load. Your legs are much stronger. Use your legs the next time, alright?
Okay.
Down low, squat, your arms straight and your back straight, okay?
Could you demonstrate for me?
Sure. So keep it close to your body, legs either side, bend with your knees, keep your back straight up like that, alright?
Okay. Thanks. Here's a picture of Emily in the sagittal plane showing her second terrible lifting technique. Now you can see here that her legs are straight. The muscles in her legs are much stronger than those in her back, however she's not using them as her knees are locked in. Instead, she's using the muscles in her back, for instance the erector spinae group. Using this group of muscles actually compresses the vertebrae of the back up to 10 times the extra pressure in the lumbar spine. Now, this puts Emily at higher risk of herniating discs in the lower back and causing further injury. Okay, so I need two arms on the keg. I need to bend my legs, chin up. That's everything you said, yeah?
Whoa, Emily, how many times do I have to tell you how to lift? Right? Just then, you twist it with your body, okay?
Oh.
Your trunk rotators aren't as strong as your legs, okay? So next time, get in, down low, and walk it to it, okay? Don't turn your torso.
Okay.
Okay? Cheers.
Here's Emily again, in the frontal plane. This time she was using a rotational movement and turning her body whilst lifting heavy weights. Now, rotating when lifting causes up to 4 times the amount of pressure on the vertebrae. It also causes excessive stress on this area. So what you can do to minimise this is put one foot up, as I got Emily to do at a later stage. Now, what this does is increases her base of support, it reduces her lumbar lordosis, and it also minimises the rotational force. Hey Cleo, I've just finished with the keys. Oh, thanks for that. How did you go with lifting them? Is there an easier option? I just found them really heavy even though I was trying with the correct technique. Okay, so you know the correct lifting technique? Yeah, I was showing that, yeah. Okay, fantastic. Well, there is an easy option. You can always get 2 people to lift them, or I can show you where the keg trolley is. If you'd like me to show you? Yes, that'd be great. Ooh, come with me. Thanks. Just get your stand your leg up here to increase your base of support. Make sure you're your back straight and your eyes are forward. And we're going to lift it up using our legs. Not our back, so straight up. How did that feel?
A lot easier, a lot better, yeah.
This is where the keg lift lives.
Yep.
I'll show you how to use it. Just pop the handle up and up it comes.
Wow,
And you
so
can wheel it
easy.
around.
Oh, great.
Another thing you'll have to watch out for is the Valsalva manoeuvre. Now this is when people hold their breath when they're lifting very heavy items. Now this Valsalva manoeuvre can cause an increase in interthoracic pressure, which causes a sharp spike in your blood pressure. This can lead to fainting, hernias, or in some severe cases, even death. Now a way to avoid Valsalva manoeuvre is to talk to the individual when they're lifting the things.